In this video, we'll talk about Neurilemmoma, and it is one of the most commonly asked short note in exams. So let's start by the definition. It is basically the benign neoplasm of Schwann cells. Now these cells, as we all know, they are neuroectodermal in origin, and they basically envelop the axon of peripheral nerve in the form of membrane. Now coming on to the other names. Now in the other names, one, as it is derived from Schwann cells, so it is called as Schwannoma. Usually there is a question with this name only in short notes or sometimes with this name. And then there is one more name which is acoustic neuroma. Now what happens is in neurofibromatosis type 2, what we see is that there is this neoplasm, it is there, and it is basically the bilateral schwannoma of auditory vestibular nerve. Okay, so that is why there is deafness and we call it as acoustic neuroma. Okay, now let's talk about the age. So it usually occurs in less than 45 years of age, and it has a female predilection. Also, it occurs in relation to the intracranial and peripheral nerves. Now peripheral nerves main, the most common site is head and neck. In intraoral, you need to remember that the most common site is the dorsum of tongue. Okay, and after this they can occur on lips, palate, floor of mouth, gingiva, buccal mucosa. Now let's talk about the clinical features. Now in clinical features, it is basically slowly enlarging, painless, well circumscribed nodule. Also, it is seen that it is smooth, firm, exophytic, and movable beneath the mucosa. It is usually asymptomatic, but in some cases we can see that it is tenderly palpable in some cases. Now, as neurofibroma is occurring around or in relation to a nerve, all right, this is clear. Now what will happen if our neurilemmoma, it increases in size, so it will lead to the compression of the nerve. Now due to this compression of the nerve, what we will see is there is going to be pain and paresthesia with the area involved, all right. Now, in oral manifestations, it usually occurs in the jaws. So, what we will see is there is going to be a well demarcated bony hard lesion which will cause expansion of cortical plates. Now, what happens is sometimes this lesion, it also occurs on the gingiva, due to which it looks like it is the fibrous epipolis. Also, yeah, this is done. So in radiographic features, what we will see is there is going to be a well-defined unilocular or multilocular radiolucency. Then there is going to be expansion and distortion of cortical plate. Then extensive bony destruction. Also, because of it occurring around inferior alveolar nerve, what will it cause is it will cause the displacement of the enlargement of the mandibular canal. Okay. Now let's talk about the macroscopy. Now in macroscopy, it is basically well circumscribed, grey colored, encapsulated mass firm consistency. It does not invade the nerve of origin. Now in histopath, it is very characteristic. Now in histopath, what you will see is there will be two types of areas. So one will be the dense areas and one will be the loose areas. Now dense areas will comprise of Antony type A cells, and the free or the loose areas, they will have Antony B cells. Now in Antony A, what is there is deeply eosinophilic, highly cellular Schwann cells. Now what happens is there is palisading of the nuclei. There is a palisading pattern of nuclei. Now what happens is at one interval there is palisading pattern of nuclei. Then there comes a free zone. Now this free zone is what is Antony B cells. Okay. Now in Antony B cells, what we see is basically there is nodule formation by the A. Okay, but in Antony B cells, since it is a loose area, so basically what you will expect is you will expect it to be less cellular and less organized, and there is no palisading pattern. Now these free zones that are present, okay, after this there are free zones. Now those free zones, they are actually made by Verroque bodies. Now Verroque bodies is nothing but the reduplicated basement membrane and cytoplasmic processes of the tumor cells. I'll write it. It is basically the reduplicated basement membrane and cytoplasmic processes of tumor cells. Alright, now in differential diagnosis, we first have neurofibroma, then we have fibroma, then we can write about the fibroepithelial polyp. I discussed about fibroepithelial polyp in the video of pyogenic granuloma. If you want to know about it, you can search it with my channel name. Then it can also be in peripheral central giant cell granuloma. Also in treatment, it is surgical excision.